algorithm, so to speak. I'm a pro. As always, please feel free to hit the like and subscribe button. Leave a comment if you liked what you see here. It helps to grow the channel. All right, let's get started. All right, the first patient we're going to take a look at is a dog that came to see me because the owner was unsure if it was having seizure activity or not. The dog was having episodes where it would sit in a certain position at home and his head would tremor. So as you can see in the video right here, this dog is having a pretty significant head tremor. But if you pay close attention, you can see that this dog is conscious, it's alert, it's responsive the entire episode. It doesn't have any full body convulsions. You're not seeing uncontrolled twitching of its face and kind of the fine muscles of its jaw. There's no hypersalivation or what we call autonomic signs. And you're not seeing this dog collapse or have convulsions or urination, defecation, swimming, paddling, things like that. This owner is able to stop the episodes, and this owner is able to talk to the dog and get it to respond, thus it is responsive. This is like a textbook example of a condition called idiopathic head tremors in dogs. This is a totally benign condition. It does not represent seizure activity in any way, shape, or form. It doesn't require medications, at least in my experience. I've never seen a dog that has to have medications. The problem is due to altered signals going from the muscle groups of the head and the neck to the brain to tell the brain kind of where the head is and how to support the head against gravity. That's the gist of it. I make an analogy to if you ever catch your foot on the ground, kind of with your heel off the ground, and sometimes you'll start making like a little sewing machine motion with your foot, kind of that bob. That's kind of the same. That's what their head is doing, essentially. So one thing you can do if you ever see your pet do this, you can simply put your hand on their head or under their chin and support their weight, or get them to move around, and they'll stop doing it. The reason they stop doing it is because it's purely a positional thing. So if their head is in a certain position, they will start doing that tremor. Again, it's totally benign, but that's the other giveaway too, that this is not a seizure, is that when their head is in a certain position, they'll do the tremor, versus when it's not, the tremor just stops. In general, if you're worried about something like this and you're not sure, always default to seeing your veterinarian to get them checked out. Every veterinarian always likes to see videos of stuff like this. So if you see your pet doing really anything weird that's an episode of any kind, in this day and age, it's so easy to get a video. Bring a video with you to the vet of your dog doing something like this. It goes a long way in helping them figure out what the episode is. All right, in the next video, this is a good example of an actual seizure. So this dog presented for what you see here in the video. This is a great example of a partial seizure in a dog. So notice how this dog is not collapsed, he's not convulsing per se, but his entire head and facial muscle structure is twitching uncontrollably. And you see how this dog is kind of like bug-eyed and staring out into space. His mentation is affected a little bit by this, I believe, too. And he can't be distracted out of it. You can't move him around, talk to him, get his attention, get him to change position. None of that's going to matter. As you see in the video, he's being held and kind of put in different positions, and he's still doing it. Also notice the hypersalivating, the facial muscles of the muzzle are kind of like twitching, and he's trying to snarl up a little bit. Those are uncontrolled groups of muscle contractions happening kind of at an irregular manner. So the big takeaway here, compare this to the idiopathic head tremors that we just saw. The biggest thing about this dog that clues you in that he's having a seizure is that he cannot be distracted out of this, and changing his head position or his body position does not change the episode. So that's more consistent with a seizure.
Now, because this dog was a Boston Terrier, we were highly suspecting either a tumor or meningitis, but fortunately for him, his MRI was totally normal. So the diagnosis was idiopathic epilepsy, and we started him on seizure medication, and he's been well controlled ever since.
Our third case today is the most common breed that we see, and that is the French Bulldog. So this Frenchie, super sweet little girl, she came in to see me for basically just kind of acting off. In my experience, I mentioned this in a previous video, French Bulldogs oftentimes show pain in very strange ways. They're an oddly stoic kind of breed a lot of the time. So when they're painful, what you'll kind of see them do a lot of the times is just kind of lock up, and they just kind of get like this, and they don't really want to move, or they're not as interactive. But what clues me in to this case in particular to help tell me what exactly hurt is if you look very carefully. So I'll show you the video pre-operative where she's walking around, and you see every now and then how her neck will kind of do this and her ears will pin back. Those are hallmark signs of neck pain in any dog, but a French Bulldog, they tend to do that a lot of the time rather than cry out like, say, a beagle would. A beagle would be a dog breed that we'd see just completely screaming if anything hurt them at all. So on my exam, I was able to feel that area, and I could feel all the muscles in the neck were just tensing up every time I touched. So it was a very clear sign of neck pain. So anytime you see a French Bulldog with neck pain, disc herniation is going to be towards the top of your differential list. So we did an MRI, and I started in the neck, and lo and behold, what we observe is a disc herniation. I'll point it out right here. But you see this kind of dark area, this dark sort of bubble sitting under the spinal cord. That's the disc herniating. So the disc should normally be sitting right there, not touching the spinal cord like you see in this area in front. That's the normal. That's a normal disc. This one right here is the disc herniation. This is C3-4, the C3-4 disc. What happens with these herniations is that the middle part of the disc, what's called the nucleus, is very dried out. So French Bulldogs are a breed that they genetically have a predisposition to having disc herniations a lot of time. You can look this up, and I talked about this in my old video. But given how much material had herniated next to the spinal cord, I spoke with the owner, and I recommended surgery to give her the best prognosis. She was walking, which is great, but my fear with these conditions is that A, the pain may not improve, and this dog had already been treated for weeks with medications to treat pain and no improvement. B, if the disc herniates more, it can actually cause paralysis, and the last thing you want on top of neck pain is just being, a quadriplegic. So we elected to go to surgery. We performed a procedure called a ventral slot, where we drilled a little kind of window at the bottom of the vertebrae. We go in this way under their neck. And as you see here, the day after surgery, she was looking much more comfortable already. These are very rewarding procedures. She's looking around kind of like this. She doesn't have any restricted range of motion to her head and neck. And at the 2-week recheck mark, we took her sutures out, and you can see she's a totally different dog. She's running around the room. She's interactive. She's not standing there flinching and kind of hesitant to move. Really rewarding to see. These are some of my favorite cases. All right, so those are 3 quick, real cases. So hope you enjoyed that. Gives you an idea of kind of what I see on a day-to-day basis. Please feel free to hit the like and subscribe button and leave a comment if you so desire. It greatly helps the channel, and I hope to see you guys again next time. Thank you.